Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the brokerage for 16. And they're working out great. So let us continue now. Today's topic is agenda and itinerary for the cruise in Asia, April 17, 2026. We'll get into that in a minute. As you know, we now have 10 employees, including 2 CPA accountants. We're in 25 states, and we're increasing our cruises around the world now. Very exciting. We're available 24/7, just about 363 days a year, and it is just Christmas and Easter the days we take off. So call us, we'll talk, have a chat, have a great time. Now, if any of you have a larger practice doing over $1 million, 4 or 5 operatories, willing to stay on, we'll be more than happy to help you sell that. Possibly a DSO would be a good idea. Possibly. We know who the best ones are, although some of them do having trouble. But we try to stick with the major ones that don't run into any financial troubles. And it's been working out quite well. But they'll often reimburse our attorney fees. Reimburse our commission. There'll be no commission to you. So based on the DSO we work with, many of them will pay it. Working out fantastic. And then if your practice is large, $1 million or more is the sale price, and it closes for $1 million or more, we'll reimburse your legal fees based on certain criteria, such as you've got to have a great dental attorney. But we've done that multiple times, reimburse the legal fees. So call us, we'll talk about it, and we'll get on it for you. Now, so itinerary for the cruise. These cruises, we have a structure in our itinerary of just what we're going to discuss and what the information is. But it's somewhat more of a relaxed atmosphere, you know. We'll have different speakers. I'll be speaking, my accountant will be speaking, and we'll give you and sometimes we'll have some of the attorneys there speaking and or CPAs. But the structure is such that you're going to learn how it works on the inside of buying and selling a dental practice. Example, what are the current bank's financing rates? How much are the banks financing? What does the buyer have to bring to the table? What is the reason that you've got to use a great dental attorney? Why do you have to set up a fantastic foundation? What is the foundation? The foundation will be the key to your success. What are some of the pitfalls in buying and selling a dental office? Why do some practices sell and others don't? We'll have to review with you realistic expectations as far as the sale price. What happens with the real estate and the dental office? How does that work? How do you allocate the monies? Will the bank finance? Generally, they'll finance 100%. Will they finance both the dental office and the real estate simultaneously? Will it be 2 different notes you're paying, mortgage notes, or one big note rolled into one? You know, how does that work? What happens with staff? Is the buyer obligated to keep the staff? Generally, they should be. But are they obligated, and what rate is the buyer going to pay? How do you build the confidence as a seller? How do you build the confidence of a buyer that it will do well? We'll share with the buyer the success rate of a dental office being transferred and sold is about 99%. It works out fantastic. People are very, very successful. We'll talk about the quickest sales that sold, the offices that sold and why, and the ones that took like forever. What happens if you have a practice in a rural area? How long does it take to sell that practice? What are the financial implications of selling a practice? And what's the financial implications and risk if you don't sell it? We'll go over all that. What's the tax rates for a seller nowadays? After they sell the practice, what's their obligation? We'll go over that these transactions are non-recourse. In other words, when you sell, you're not obligated. After you sell, the obligations are minimal. That is, it's non-recourse. If a practice doesn't work out, it's not your fault. So many different topics we're going to get on. We're going to discuss, and it just goes on and on and on. We'll have a whole list of everything, and from legal, from financial, business, social, everything we will discuss. And I think it's going to work out great for you. You're going to learn a lot. But what makes it different is the interaction with other people that are there, so you have an understanding. We'll have questions and answers. We'll have surveys you got to fill out, but we'll have questions and answers there. You can questions that you may haven't fulfilled. Now, we have a pretty extensive website. We have 1,450 YouTube videos now on this subject. But there's always something that you may have a question on, or you didn't have a greater understanding of, or how the integration actually works. We'll talk about whether you should or should not get the staff informed before you, before you sell the practice. So this is just a few of the topics. We'll have a complete list of everything. We'll have a syllabus. We'll have an itinerary for the days. Generally, what we do is we'll try to meet in the mornings before you depart the ship, or at the end of the day. Generally, you're back on the ship by 4:30. We'll have a meeting then. It'll be several different time slots, but we try to do it like 2-hour time slots. Then, of course, when we have the days at sea, we'll also be lecturing, and we'll alter the time a little bit. It may not be at the end of the day, maybe right in the morning. And we'll sit down, and the exchange of information you're going to find is invaluable. I mean, we're doing this for 16 years. We feel that we have a lot to share. And for 16 years, we're doing it. So we feel that we've learned a lot. Of course, I was a dentist for 25 years. But multiple topics. So this will happen every day. There will be a discussion. Every day will be a presentation. Some of the presentations will be PowerPoint. Some will be question and answer. But you're going to come away with valuable information that you're just not going to get while you're reading up. And as you know, with our YouTube videos, we give you cutting edge information, stuff that just hit the press. Like, what do you do when you have a closing coming up and the buyer starts getting cold feet? How do you rescue the deal? What happens if the seller gets cold feet? How do you rescue the deal? What happens if the landlord is not being compliant at all? What are your alternatives to do? And then anomalies. If you listen to some of my tapes, the strangest things happen. Oh, God. We'll share that with you. Why does it sometimes take so long to get the closing done? Why do you always what are the different roadblocks that you encounter when you in the sale of a dental practice? But rest assured, we'll get you the closing. It'll work out great. We're always available to help you. We're going to show you what I and my team can provide you with. So it should work out real nice. Anyway, thank you for listening. Get ready for cruising. Get ready for continuing education credits, which you'll be granted. And I think it's going to be a great cruising experience. We have the one coming up in, that's just in a few weeks, about a month away. That's the Asian cruise. And then we have the other one coming up around January 12th or January 16th of 27. So call us about that. We'll get going. The Asian cruise leaving in a few weeks. All right. Well, thank you very much for listening. Thank you. Bye.